Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. We'll be speaking with Dr. Michael Boland. He's joining us to talk about some presentations from the 2023 American Academy of Ophthalmology annual meeting regarding AI and glaucoma. Welcome to Health Professional Radio, Dr. Michael Boland.
Thank you very much. My pleasure.
Tell us a bit about yourself. Where is it that you practice? What is your specialty?
Excellent question. So I'm a glaucoma specialist, obviously. I practice at Mass Eye and Ear in Boston. And I have sort of a technology bent going back to my undergraduate times. I was an engineering major and then ended up deciding to go into medicine. And then, did a PhD actually in using sort of machine learning, artificial intelligence techniques back in the 90s when this was all cool for the first time. And then we sort of had a long period of no progress. And then, as I think everyone knows, we've had a lot of progress recently. And that also fits in with my other role as I'm the medical director of practice innovation for ophthalmology here at Mass Eye and Ear, where my job is to help integrate technology of various sorts into our clinical practice.
We're hearing so much about artificial intelligence, AI. It's being used in everything from resume writing to car repairs. How's AI being used in relation to glaucoma?
Sure. So there's no direct clinical application yet, I think. So we're still in the kind of the research phase in glaucoma. But we've had excellent success in the diagnosis of glaucoma. So that's particularly in reviewing fundus photographs, right? Photographs of the optic nerve. We've had large projects, mostly out of China, where they've had really great success identifying, persons with glaucoma using artificial intelligence. We've had people apply artificial intelligence to optic nerve imaging, so optical coherence tomography and the like. And we've had people apply it to visual fields, particularly trying to predict, so given some sort of set of baseline characteristics of a person, what is the likelihood they're going to get worse, or to predict their visual field, 5 years in the future. So those have all been, I think, really important kind of research steps that I think are going to require a lot more, and we'll get into this later, I think, about some of the limitations, but going to require a lot more work to get those into products that can then be brought into the actual clinic. And then beyond that, there have been some fun projects, like one of my favorite ones was folks at the University of Washington created an AI that will help analyze, Goldmann applanation tonometry for checking eye pressure. It helps to assess, when you've reached the endpoint of that test using image analysis and AI.
What are some of the challenges that you anticipate arising when using AI in relation to glaucoma?
Sure. So I think the number one challenge for us is that we don't have a great sort of computational definition of glaucoma, right? So it's still a little bit of, doctor looks at a bunch of stuff and decides the person has glaucoma based on optic nerve structure, whether it's photographs, optic nerve imaging, and optic nerve function, which is visual field testing, and then plus or minus other aspects of the person, demographics, age, family history, and increasingly genetics. So what we don't have is I can't give you a coherent definition of what glaucoma is from all those criteria, and that makes it hard to train these AI systems, right? So things like diabetic retinopathy, we have very clear criteria for what constitutes mild, moderate, severe diabetic retinopathy, and we can then train AI systems based on those gradings, but we don't have that for glaucoma. And I think companies that have tried to make this happen have realized that the variability of even asking clinicians, is this glaucoma or not? The variability is low when the person is totally normal and when the person has end-stage glaucoma, but everything in between, so mild, moderate disease, there's a fairly wide variability across people. So that's the number one challenge. I think number two is getting enough data in one place, right? So unlike some of the, quote, easier solutions, diabetes, macular degeneration, where all you need is the photograph, glaucoma, we need multimodal data. So we need optic nerve images, we need visual fields, we need clinical data all put into one pile, and we don't have great data set for that. And then I think there are the kind of generic issues that I brought up when I was talking about this at the meeting that all these AI systems are going to face, and that is issues around equity, right? So even if we have these data sets, we want to make sure they have all the right kinds of diversity and of our patient population included, right? And that tends to be not the case all the time. So just like groups are underrepresented, in seeking care, they then become underrepresented in these AI models and so that models don't work as well for those groups. And then similarly, making sure that things that are developed at one location then are applicable and generalizable to other institutions. We've seen this with models outside of glaucoma, but say predicting sepsis risk. One institution builds their sepsis risk calculator for the ICU, and then as that gets exported across the country, it becomes much less good at predicting just because things are not the same there, right? And so those kind of challenges are going to be sort of very practical, but are going to require a lot of work to make these things, eventually end up in clinic.
In discussions and presentations from the 2023 AAO, what were some of the solutions or some of the studies that we may see coming down the line when it comes to AI and glaucoma?
So I think we're going to get much better prediction of who's likely to get worse. I think this is sort of it's a key decision for us in glaucoma, right? Trying to decide who is at highest risk of losing more vision or more optic nerve from the disease. And that's important both for patient care. So we want to get those people into more sort of intensive levels of monitoring or therapy. And then also I think the other piece that meshes is going to be around other kinds of glaucoma therapy that are not just pressure lowering, right? So I think we all look forward to a time where we have some kind of neuroprotective agents that can protect the nerve without having to lower pressure inside the eye. And the problem now is those studies require, at least with current designs, at least very long periods of time of monitoring people to determine that, that your drug is slowing the rate of nerve damage compared to just pressure lowering. And so the more we can get that done quicker, the easier it will be for drug companies to then say, we have a product we want to evaluate. We can't really spend 10 years figuring that out, but we can spend 2 or 3 years on a study. And so, these kind of AI predictive models are going to be important, I think, in that aspect as well.
Is there anything that you'd like to add for our listeners, and then give us a website where our listeners can learn more?
Sure. So I think the next steps, I think, for all of us as we think about AI, we're sort of, I love the hype cycle model of all this stuff, and we're clearly at the peak of what they call the peak of inflated expectations, where everyone, is imagining AI is going to solve all of our issues. And on the hype cycle, that comes right before the trough of disillusionment, where we all realize it's much more complicated. So I think we have to be aware of these limitations we talked about, some of the demographic issues, some of the small sample size issues. I think we need to work on a consensus definition of glaucoma. I think we need to be more careful about comparing the performance of these models, making sure we're including age, race, and sex in ways that make sense. And then I think we need to also be more able to share data sets, right? And some of this gets to a culture of sharing, and then also around data standardization, around how we share the data and make it available to other people and other investigators to really advance the field.
And a website where we can learn more.
Sure. I think anybody can go to masseyeandear.org, and we'll have more information there about these topics.
Michael, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio.
My pleasure. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Michael Boland. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.